Hey guys, so in this video I wanted to respond to a comment that is actually, I'm pretty sure, a troll comment, but I felt like just in case there's anybody out there who thinks that this is what medical assistants actually do, I just want to set the record straight. So this comment was left on a video that I recently uploaded titled, "I applied for a new job with 3 question marks." So this person, Marsha Smoke, said, "All you do is take vital signs and say, quote, the doctor will be right with you. How much did you expect to get paid?" So in that video, I was talking about the fact that I applied for the job that I currently have in the sleep center. That was when I was working full-time in a rural health clinic as a medical assistant. I do still work in that same clinic as a medical assistant. I just do it basically to cover shifts when they need me to on a PRN type of basis. So first of all, medical assistants do not just take vital signs and say that the doctor will be right with you. While that is something that we do, it is not the only thing that we do. A lot of our job is helping situate things for patients, giving patients test results, talking to them on the phone, sending in refill requests, like calling pharmacies, coordinating certain things with care, talking to different medical facilities, trying to get things set up for patients, reminding patients that they need to come in, especially if they are not like a care coordination type of patient who they don't have like a care manager who is able to remind them of certain things, giving people education, doing vaccinations, helping the provider with procedures. I like the provider that I worked with right before I changed positions. I helped him with a lot of different procedures. I helped him with joint injections and things like that. So I would prep the patient. I would do a lot of things. It is a lot more than just doing vital signs and telling the patient that the doctor will be right with you. So I just think that, a lot of people think because medical assistants are not nurses, that that's the only thing that we're able to do is do vital signs, and it's totally incorrect. So at the clinic that I work at, medical assistants and LPNs have basically the exact same job duties. It is just they get paid a little bit more than us because they have a better education than medical assistants do, because the LPNs have degrees and medical assistants, we don't need a degree to become medical assistants. I know there are some people that choose to get a degree in medical assisting, but it is not necessary to become a medical assistant. So that is why the nurses in the clinic get paid more, but our job responsibilities are exactly the same. I kid you not, like we do the exact same things. So I feel like it does us a disservice to say that that's all that medical assistants do. I feel like there are a lot of reasons why medical assistants should get paid more than what we do. There's a lot of reasons why a lot of people in healthcare, different positions, should get paid more than what they do. If these people understood exactly what you have to go through on a day-to-day basis when you work in healthcare, the things that you have to put up with, the things that patients say to you, the way that family members treat you. Like, I have been hit, punched, kicked, slapped, spit on. Like, there's so many things just working in healthcare as collateral damage because I'm there, they're angry, and so they lash out on the person that is closest to them. It is a scary experience, and I just think that it does a disservice to medical assistants as well as other healthcare professionals to say that that is all that medical assistants do. So I'm not saying that I get paid a super low wage, but as a medical assistant, there are a lot of facilities, pretty much every other facility in the area other than in the town that I live in gets paid more for medical assisting jobs than the ones at the clinic, which is part of the reason why I switched, but also because I wanted to further my career. And I also like to learn, and I felt like working in the sleep center would be a little bit more closely related to my degree in neuroscience, because a lot of sleep has to do with different functions within the brain, which is things that I study as a neuroscience bachelor's degree student. So to end this video, or in conclusion, I just want to say that I do a hell of a lot more than just take vital signs and say the doctor will be right in. Half the time, the providers that I've worked with don't even have a clue about what all is going on with this patient until I tell them exactly what's going on with this patient. I have interacted with a lot more of patients on a more consistent basis than the provider, just because I am more available than the provider. Because the provider is busy seeing other patients and handling other medical concerns for a ton of patients, I am able to have a better, closer relationship with the patients because I'm able to talk to them more. I'm able to see them if they come in to have like questions answered about a medication that was sent in, or about what the provider wants them to do, or when they want follow-up. I talk to them on the phone. Most of the time I was like the screening before they were able to speak to the provider, if they were even able to speak to the provider. So I just wanted to say that if you are a medical assistant or a clinic nurse, please chime in if you have anything else to say other than what I have shared already. And with that being said, that's all I have for today. I hope you guys are having a wonderful day. And medical assistants do a hell of a lot more than just take vital signs and say the doctor will be right in with you. If that was the case, you could get a CNA to do all that. You don't need a medical assistant. We do a hell of a lot more. We do vaccines, injections, we help with procedures, and basically anything else that the doctor has us trained in or that we have been trained in. I do blood draws. I do a whole lot. So anyways, I will get off my soapbox now. I hope you guys are having a wonderful day, and I will see you guys next time.